Primrose oil, what is it? How is it used? Are there risks? Are there benefits? Will it kickstart you into labor? That's what we're going to talk about today. Hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and now I prepare you from bump to bassinet for labor, pregnancy, birth, postpartum life. So I have read lots of studies, and I read the studies on Primrose oil, and I was really intrigued by what they have to say. I also watched some videos here about Primrose oil, and I was really disheartened by what people were saying and how they were using it, because a lot of times it's just a one-off. This is what worked for me. This is how you should use it, and it's not the recommended way to use it. So today I want to share the studies, how they recommend to use it, and how to talk with your provider about it if you are thinking that it is right for you after you look at the studies. Before we get going, this absolutely should not be used prior to 37 weeks of pregnancy. This absolutely should not be used without the acknowledgement of your provider. Now, we're going to talk more about that later. I don't think anybody's provider is going to be like, yeah, go home and use it. Maybe they will. Midwives, maybe, but I don't think OBGYNs are going to be like, yep, sure, use Primrose oil. Let's talk about what the heck is Primrose oil. It is an oil from the primrose flower. This is actually a fish oil capsule, but it looks just like this, and you can buy it at the store. There is something within fish oil that creates prostaglandins. So it works similarly to a Cytotex or Vidil or a Prostin gel. So that's what it's hopefully doing, and it's been used for years with midwives, right? They would gather this flower, make the oil, and use it in their practices. And so that's why it is so studied. It is very studied. Every once in a while online, I'll have somebody be like, well, there aren't any studies. There are a fair amount of studies on this, and if your provider's saying there aren't any studies on it, there are. I link them all in my article, which you can find in the notes. So there are studies on this. Let's talk about what we learned. Of course, like anything, there are mixed results in the studies. The big one, the meta-analysis, which combines lots of different studies, which is usually the one that I go to, showed that there was a decreased amount of time being pregnant. They didn't show what the decreased amount of time was. And I went through like lots of different things trying to look to see how much less time you were being pregnant, because if it's only 15 minutes, that's really different than if it's 3 days, right? So decreased time being pregnant from when you took it to when you had the baby, and they were comparing this with a placebo, which is what you need to do, not just looking at people who took the medicine. They need to compare it with, they are giving this capsule that just has coconut oil in it or something. Probably not coconut oil, because you're not supposed to put that inside, but they're just comparing it to a placebo, the medicine to a placebo. So decreased amount of time being pregnant and better 5-minute APGARs, which usually shows the baby kind of had an easier time of being birthed, although, you know, that's just a guess. We don't actually know why that happened. Other studies showed, one where they took it orally, showed there was no decreased time in being pregnant, no real benefits. The big one that your providers are probably going to look at is from the American Journal of Gynecology, said that they ultimately do not recommend it or castor oil because they didn't feel like the benefits of taking it for cervical readiness is worth it, the risks that they see overall. Meaning that they really just don't think that it helps to make your cervix more favorable. Of course, there's different dosing. People talked about different doses, different ways to take it. You can take it orally, you can take it up the birth canal. So there's different ways that you can take it based on the studies. Hilary from the future here. I apparently didn't mention any of the risks that were shown in the studies. There were a few small ones: increased time rupture of membranes, failure for fetal descent. There was some meconium staining. I link all of that in the article, but there are some risks that you'll want to talk with your provider about before trying it. Now, if Hilary was looking at this, I was like, when I saw that meta-analysis, I was like, this is awesome. That's a great thing. This is something that people can really try, right? Of course, we don't know how much it decreased your time of being pregnant. But the other thing to think about is you're putting the ones that showed that it really worked, they were using it vaginally, which means you're putting something new up the birth canal that has all this extra blood flow when you're pregnant, which means you're much more likely to react to things. Plus the idea of me getting down there to put things inside doesn't sound the funnest when I'm 9 months pregnant. So you have to weigh that versus the benefit that you might kickstart into labor or you might not. So if you've read the studies, you're past 37 weeks, you don't have any of the foreseeable risks, which includes you need to be able to have a vaginal delivery, any platelet issues, you shouldn't be taking this. They've seen issues with people who have any schizophrenia in their past or probably in their family, shouldn't be taking this. You don't have any of those things, you want to talk with your provider because of course that's what you want to do. You go to your provider and he says, you know, I really just don't recommend it. You shouldn't be taking it. And a lot of people, I think, in their head would be like, well, my doctor told me I couldn't. And I am just here to tell you that your doctor doesn't have that right. They can't tell you that you can or you can't do something. So if my doctor were to come back, I've decided, yeah, I really think that this is right. They really don't have any compelling evidence other than that they just don't think it will work. I would come back with them and I would say, you know what, I'm going to try the Primrose oil, and I'm just wondering what to watch for, anything else I could be aware of. If you really think it's contraindicated, that I really should not be doing it, I want to know that. Otherwise, I think I'm going to take it. And then they, as your consultant, that's what you're paying them for. You're not paying them to tell you what to do. You're paying them to give their expert advice, which, by the way, in this instant is really them covering their buns. Because if they were to say, sure, go ahead and use that, and then you go home, you react, baby doesn't do well, there's issues with your pregnancy, then you can come back and sue them. So they really are covering their behind by saying that they really don't recommend this, which hopefully you understand. But again, you're paying them as a consultant, and if they say, I don't recommend it, but if you want to do it, then hopefully they give you some ideas of what to watch for, making sure that it's not contraindicated. And then they just know. So 12 hours later, when you call them and you're like, I think I'm in labor, then they know, you know, she took Primrose oil at home and it's all on the up and up. And I think that is so important. If you are feeling like, I can't talk to my provider like that, I can't make decisions on my own, I can't read studies, I can't understand risks and benefits, I would 100% recommend taking a birth class so that you really can understand that. Providers do not have enough time to discuss everything in the office. So when you have a basic understanding through a birth class, they can really help you extend that learning on how it works for you. So you're not spending all this time learning what a favorable cervix is because you already know that, and you're understanding how you might be able to get a favorable cervix at home. And by having that baseline education through a birth class, which I recommend the online prenatal class for couples, you can find the link down there, or at onlineprenatalclass.com, it really extends your prenatal appointments to be more about you. In summary, it may decrease the amount of time that you were pregnant, which sounds like a big win. Increased 5-minute APGARs, which also sounds like a big win. Your provider is probably not going to say, sure, go ahead and do it, but it is ultimately up to you. But I would read the study, see if it's worth it. You know, maybe you try it once and it's a little bit itchy, or it's just really hard and you just decide it's not worth it, then that's fine too. If you're looking for other things, I have articles about like dates and castor oil. I do not recommend castor oil for a variety of reasons, but dates might be a viable option as well if you were, you know, prior to like 36 weeks. I will say with the Primrose oil, they were also starting at 37, 38 weeks, taking it frequently. The frequency varied between study to study. So there you go, Primrose oil. If you have questions, tell me in the comments. I would love to chat more about it. Otherwise, be sure and try and find some of my other videos that can interest you as well.